How do you stay updated with the latest medical advancements and nursing protocols?
I believe learning never stops in nursing, so I make a conscious effort to stay updated and improve my practice. I regularly use reliable online resources to keep myself informed about current guidelines and evidence-based practice. I follow trusted health organizations and read nursing journals that publish updated research and clinical recommendations. When I have time, I also watch educational videos from reputable medical sources to strengthen both my theoretical knowledge and practical understanding. I value learning within the workplace as well. I actively participate in in-service training sessions, case discussions, and protocol updates. Whenever new policies or medication guidelines are introduced, I make sure to read them carefully and understand how they apply to daily practice. I also learn a great deal from experienced colleagues by observing their approach and discussing complex cases with them. Reflection is another important part of my learning process. After managing challenging situations, I take time to think about what went well and what could be improved. Discussing cases with the team helps reinforce good practice and identify areas for growth. I'm also open to formal courses and professional development programs. If given the opportunity, I would actively participate in any training sessions or workshops offered by the organization. For me, staying updated is not just about meeting requirements. It is about ensuring that I provide safe, effective, and high-quality care to every patient.
Where do you see yourself in 5 years within your organization?
In 5 years, I see myself as a confident, skilled, and trusted member of the nursing team. My first goal is to fully integrate into the hospital system and become highly familiar with all protocols, standards, and expectations. I want to be someone my colleagues can rely on during busy shifts and someone patients feel safe with. Once I am fully confident in the working environment, I would like to gradually take on more responsibility. I am interested in developing deeper expertise in a specific area of nursing, such as medical surgical care, and strengthening my clinical decision-making skills. I also enjoy supporting and guiding others. In the future, I would welcome the opportunity to mentor new staff members or assist in training junior nurses. Sharing knowledge and helping others grow is something I find rewarding. Most importantly, I'm looking for long-term professional growth. I want to continue improving my skills through ongoing education and practical experience. In 5 years, I hope to be seen as a valuable, dependable nurse who contributes positively to the team and the organization as a whole.
What does care and compassion mean to you in a clinical setting?
To me, care and compassion mean recognizing the person behind the diagnosis. Nursing is not only about completing tasks such as monitoring vital signs or administering medication. It is about understanding how illness affects someone emotionally, mentally, and socially as well. Compassion is often shown in small but meaningful actions. It can be as simple as pausing to reassure a patient who looks anxious before a procedure, or explaining a treatment plan in clear, simple language so they feel less afraid. These moments may seem brief, but they build trust and reduce anxiety. In my experience, small acts of kindness can make a noticeable difference. I once cared for a patient who was very worried about responsibilities at home while hospitalized. I took time to listen and help them contact their family. That simple support reduced their stress and helped them feel more at ease. Emotional comfort can positively influence physical recovery. Compassion also means protecting a patient's dignity at all times. During personal care, I ensure privacy, speak respectfully, and involve the patient in decisions about their care. No matter how busy the shift is, I remind myself that each patient deserves to feel valued and respected. For me, clinical competence and compassion go hand in hand. Treating the medical condition is essential, but caring for the person as a whole is what truly defines good nursing. That is the standard I aim to uphold every day.
How do you handle the transition to a new culture and work environment?
I already have experience adapting to a new international work environment, which gives me confidence. When I first moved abroad for work, everything was new to me. The language, the customs, and the hospital policies were different from what I was used to. I handled it by being open and respectful from the beginning. I made it a priority to observe and learn. I paid attention to how local colleagues interacted with patients and with each other. Whenever I was unsure about a cultural practice, I asked questions instead of making assumptions. For example, I quickly understood the importance of respecting patients' personal beliefs and daily routines, and I adjusted my practice accordingly. I also made an effort to learn basic phrases in the local language. Even simple greetings helped me connect better with patients and show them that I cared. For Malta, I plan to follow the same approach. I have started learning about the culture and healthcare system. I understand that English is widely spoken, which will help with communication, but I'm also willing to learn a few local words to build better rapport, especially with elderly patients. I know that adjustment takes time. I remain patient with myself during this period and focus on being a good listener, a respectful colleague, and a reliable nurse. I believe that with a positive attitude and willingness to adapt, I can integrate smoothly into the team and community.
Why should we choose you over other international candidates?
I believe you should choose me because I bring a strong combination of clinical competence, leadership experience, and adaptability. First, my clinical background is solid. I have over 7 years of experience working in hospital settings, particularly in medical and surgical wards. I am comfortable managing multiple patients and understand the fast-paced nature of a busy healthcare environment. I always focus on delivering safe, efficient, and compassionate care. Second, I have leadership experience. In my previous role as a senior nurse, I was responsible not only for my assigned patients, but also for coordinating the team, organizing patient rounds, and supporting the training of new staff members. This experience has strengthened my organizational skills, communication, and ability to ensure smooth workflow during shifts. I can contribute not only as a staff nurse, but also as someone who supports team coordination. Third, I have successfully adapted to a new professional and cultural environment before. Transitioning into a different healthcare system taught me how to be flexible, respectful, and open-minded. I learned to communicate effectively across cultures and adjust to new policies and expectations. I am confident in my ability to adapt again and integrate well into your team. Finally, I'm looking for long-term growth. I am not seeking a temporary position. I want to build my future within a stable healthcare organization where I can continue learning, contribute meaningfully, and grow professionally. I am ready to bring my experience, dedication, and compassionate approach to your hospital and remain committed for the long term.
Describe your experience with the 6 C's of nursing.
The 6 Cs are at the center of how I practice nursing every day. I do not see them as separate values, but as one complete approach to patient care. For me, care and compassion always go together. I once cared for an elderly patient who was admitted alone and had difficulty communicating in the common language used in the hospital. The patient was clearly anxious and frightened. I took a few extra minutes during my rounds to sit beside them, offer reassurance, and use simple words and gestures to communicate. That small act of compassion helped build trust and made the patient feel safe. This also reflects competence. Because I took the time to connect and observe carefully, I was able to assess the patient's needs more accurately, including nonverbal signs of discomfort. Clinical skills are essential, but they are most effective when combined with understanding and empathy. Communication is something I consistently focus on improving. I make sure to explain procedures clearly to patients and families, especially when they are anxious or uncertain. I also value clear communication within the healthcare team. In my previous leadership role, I had to give clear instructions during busy shifts to maintain patient safety and avoid errors. This often requires courage. There have been situations where I needed to respectfully question an order or raise a concern to protect a patient's well-being. Speaking up is not always easy, but advocating for patients is part of our professional responsibility. Finally, commitment is what guides my career. I am committed to maintaining high standards of care, continuing to learn, and adapting to new environments. I am dedicated to being a reliable and supportive member of the team. For me, the 6 Cs are not just principles. They represent the foundation of why I chose nursing and how I practice it every day.
How do you handle a patient who suddenly develops difficulty breathing?
In an emergency, I remain calm and act quickly because I understand that clear thinking can save lives. I recall a situation where a post-operative patient suddenly became restless and began gasping for air. I immediately recognized the signs of respiratory distress. My first action was to call for assistance while staying with a patient. I activated the emergency response system and asked a colleague to bring the necessary emergency equipment and inform the doctor. While waiting for the team to arrive, I positioned the patient upright to improve breathing and loosened any tight clothing. I reassured the patient in a calm voice, encouraging slow, steady breaths to reduce panic. At the same time, I assessed vital signs, checked oxygen saturation with a pulse oximeter, and administered oxygen through a face mask at an appropriate flow rate. I also ensured that the airway was clear. When the doctor arrived, I provided a clear and concise report of the situation, including the patient's symptoms, vital signs, and the interventions already performed. The patient was later transferred to a higher level of care for further management. After the situation was stabilized, I completed accurate documentation of the event and the actions taken. This experience reinforced the importance of rapid assessment, teamwork, clear communication, and staying composed under pressure.
What are the signs of a deteriorating patient?
Recognizing a deteriorating patient early is one of my top priorities as a nurse. I pay close attention to small but significant changes in a patient's condition. First, I monitor vital signs carefully. A drop in blood pressure, an unusually high heart rate, or a sudden decrease in oxygen saturation are clear warning signs. Changes in respiratory rate are especially important. Breathing that becomes very fast, very slow, or shallow can indicate serious problems. Second, I assess the patient's level of consciousness. If a patient who was previously alert becomes confused, drowsy, or difficult to arouse, I treat this as a serious concern. Even subtle changes in behavior, such as delayed responses or unusual quietness, can indicate early deterioration. In one situation, I noticed a patient who had been stable earlier became slightly confused and less responsive. I reassessed immediately and identified abnormal vital signs that required urgent medical review. Third, I observed physical signs such as skin color and temperature. Pale, cold, or clammy skin may suggest poor circulation or shock. I also monitor urine output closely, as reduced output over several hours can indicate decreased organ perfusion. Finally, I trust my clinical judgment. If a patient says they feel unwell, or if I sense that something is not right, I do not ignore it. I perform a thorough assessment and escalate my concerns promptly according to protocol. Early recognition and timely intervention are essential to preventing serious complications and saving lives.
Describe the steps you take during a blood transfusion reaction.
I understand that quick and correct action during a blood transfusion reaction is critical for patient safety. I recall a situation where a patient receiving a blood transfusion suddenly complained of chills and lower back pain. I immediately recognized these as possible signs of a transfusion reaction. My first action was to stop the transfusion at once. I clamped the blood tubing to prevent any further blood from entering the patient. I did not delay this step. Next, I maintained intravenous access by starting normal saline with a new giving set to ensure the line remained open for any emergency medications if required. I then rechecked the patient's identity details and the blood product to confirm accuracy. While a colleague informed the doctor, I stayed with the patient and closely monitored vital signs. I noted changes such as a rising temperature and shivering. I reassured the patient calmly, explained that the transfusion had been stopped, and ensured they were kept warm and comfortable. When the doctor arrived, I gave a clear and concise report, including the patient's symptoms, vital signs, and the time the reaction began. As instructed, I assisted in collecting required blood and urine samples and ensured that the blood bag and tubing were sent back for investigation according to protocol. After the situation was managed, I completed thorough documentation of the incident and all interventions performed. Acting promptly, following protocol, and remaining calm helped prevent the reaction from becoming more severe.
How do you manage a patient with a high fever post-surgery?
Managing a post-operative fever requires prompt action to ensure patient comfort, along with careful assessment to identify the underlying cause. I recall a situation where a patient developed a high fever on the first evening after abdominal surgery. I began with a full assessment. I checked the temperature, which was significantly elevated, and also monitored heart rate, blood pressure, and oxygen saturation. I inspected the surgical wound for signs of infection such as redness, swelling, or discharge. I also assessed respiratory status, as post-operative fever can sometimes be related to chest complications. To help reduce the fever and improve comfort, I first used non-pharmacological measures. I removed excess blankets and applied tepid sponging to the forehead and arms. I encouraged oral fluids in small amounts, as appropriate for the patient's condition, to maintain hydration. I then informed the doctor and reported my assessment findings clearly. Following medical instructions, I administered the prescribed antipyretic medication intravenously. I remained with the patient to monitor their response and reassessed vital signs regularly. Within some time, the temperature began to decrease and the patient appeared more comfortable. I continued close monitoring and documented all observations, interventions, and the patient's response accurately. My role in this situation was to assess thoroughly, act promptly to reduce discomfort, and communicate effectively with the healthcare team to ensure safe and timely management.
What is your process for administering high-risk medications?
Administering high-risk medications is a responsibility I take very seriously. I follow a strict and consistent process every time to ensure patient safety. My approach is based on the rights of medication administration, but I go beyond that. First, I carefully review the medication order and compare it with the prescription. I confirm the patient's name, the medication name, the exact dose, the route, and the correct time of administration. For high-risk medications such as insulin, anticoagulants, or strong analgesics, I always perform an independent double-check with another registered nurse. We review the prescription, calculation, and medication vial together before preparation and administration. This step is essential and never skipped. At the bedside, I verify the patient's identity again by asking them to state their full name and date of birth, and I check their identification band. Proper patient identification is non-negotiable. I also assess relevant clinical parameters before administering certain medications. For example, I review recent vital signs and laboratory results when required. If a parameter is outside the safe range, I withhold the medication and inform the doctor immediately. After administering the medication, I observe the patient for any immediate adverse reactions. I document the administration promptly and accurately, including the route, time, and any relevant observations. I also provide brief education to the patient about the medication and what effects to expect. By following this careful step-by-step process, I ensure patient safety and maintain high professional standards in medication management.
How do you handle a medication error you've made?
I believe honesty and patient safety must always come first, even when the situation is uncomfortable. Early in my career, I made a medication error. During a very busy shift, I accidentally administered a patient's scheduled medication twice within a short period of time. I realized the mistake shortly afterward while reviewing the medication chart. My immediate reaction was concern and embarrassment. However, I knew that transparency was essential. I informed my senior nurse immediately and clearly explained what had happened, including the patient's details, the medication involved, and the timing of the second dose. I did not try to justify the mistake. Together, we assessed the patient right away. I checked vital signs and monitored for any symptoms related to the extra dose. The patient's readings were slightly outside their usual range, but they remained stable and reported no concerning symptoms. We continued close monitoring for several hours to ensure their safety. I completed an incident report honestly and documented the sequence of events accurately. Afterward, I reflected carefully on the situation. I recognized that I had allowed myself to become distracted and had not performed the final check as carefully as I should have. Since then, I have changed my practice. I make it a rule to pause and focus completely during medication administration, no matter how busy the shift is. That experience strengthened my commitment to safe practice, accountability, and continuous improvement.
How do you manage a patient with a suspected myocardial infarction?
When I suspect a patient is having a heart attack, I understand that time is critical and immediate action is necessary. I recall a situation where a middle-aged patient arrived with severe chest pain. He appeared pale, sweaty, and described a heavy, crushing pain radiating to his arm. I immediately recognized these as possible signs of a cardiac event. My first priority was rapid assessment and stabilization. I called for medical assistance while staying with the patient. I positioned him in a semi-upright position to help reduce cardiac strain and improve comfort. I administered oxygen as per protocol and attached him to a cardiac monitor to observe heart rhythm. I quickly assessed vital signs, noting abnormalities that supported my concern. At the same time, I ensured intravenous access was established so that emergency medications could be administered without delay. I performed a focused pain assessment and checked for any medication allergies, particularly to commonly used emergency drugs. When the doctor arrived, I gave a clear and concise handover, including the patient's symptoms, vital signs, and interventions already initiated. I assisted in performing an electrocardiogram promptly, which confirmed the diagnosis. Throughout the situation, I remained calm and continued reassuring the patient, as anxiety can worsen cardiac stress. Once medications were prescribed, I administered them as ordered and prepared the patient for transfer to a higher level of care. This experience reinforced the importance of early recognition, rapid intervention, teamwork, and clear communication in managing life-threatening emergencies.
What are your priorities when caring for a diabetic patient who is non-responsive?
When I find a diabetic patient who is non-responsive, I immediately consider abnormal blood glucose levels as a possible cause. Severe hypoglycemia or hyperglycemia can quickly become life-threatening, so prompt action is essential. My first priority is always airway, breathing, and circulation. I check whether the patient is breathing and has a pulse. If they are breathing but unconscious, I position them in the recovery position to maintain a clear airway and reduce the risk of aspiration. Next, I check the blood glucose level using a bedside finger prick test. This provides immediate and crucial information. In one situation, I found a diabetic patient unconscious and quickly activated the emergency response system while remaining with the patient. The blood glucose reading was critically low. Since the patient was unresponsive and unable to swallow safely, I did not administer anything orally. I established intravenous access promptly. Following protocol and medical instructions, I administered intravenous dextrose. I monitored the patient closely for improvement. Within a few minutes, the patient began to regain consciousness. I reassessed vital signs, ensured continued stability, and provided reassurance as they became more alert. After the situation was under control, I completed clear and accurate documentation. In such emergencies, my priorities are clear: maintain airway safety, assess blood glucose immediately, initiate appropriate treatment without delay, and monitor the patient closely for response.
Explain the importance of the Waterloo scale or other pressure ulcer risk assessments.
I believe the Waterloo scale is an essential tool for preventing pressure ulcers before they develop. Pressure ulcers can be painful, slow to heal, and may lead to serious complications. The purpose of the Waterloo scale is to identify patients who are at risk so we can intervene early and prevent harm. The scale looks at multiple risk factors, not just mobility. It considers age, body weight, skin condition, nutritional status, continence, and underlying medical conditions that may affect circulation or healing. By assessing all these factors together, it gives a clearer picture of the patient's overall risk level. I use this tool as part of my routine assessment, especially for patients who are elderly, immobile, or seriously ill. In one case, I assessed a patient with limited mobility following a major health event. The Waterloo score was high, which indicated a significant risk of pressure damage. Because of that score, we implemented preventative measures immediately. We followed a strict repositioning schedule, ensured the use of pressure-relieving mattresses and cushions, and maintained careful skin care. I performed regular skin inspections, paying close attention to high-risk areas such as the heels, sacrum, and elbows. By using the Waterloo scale to guide our care plan, we were able to prevent pressure ulcers throughout the patient's stay. For me, the scale is not just a form to complete. It is a practical tool that helps turn assessment into a clear, documented prevention strategy that protects vulnerable patients.
What is your experience with postoperative care and wound management?
Postoperative care has been an important part of my nursing practice from early in my career. I have cared for surgical patients through every stage of their recovery, from the immediate post-anesthesia period to discharge planning. Right after surgery, my priority is close monitoring for complications. I check vital signs regularly and watch carefully for signs of bleeding, shock, or respiratory problems. I assess the patient's level of consciousness as they recover from anesthesia and ensure their airway remains clear and stable. Pain management is also essential. When pain is controlled properly, patients can breathe deeply, mobilize earlier, and recover more comfortably. Wound care is something I approach with strict attention to detail. I always follow a septic technique during dressing changes to prevent infection. I inspect the surgical site carefully for redness, swelling, warmth, discharge, or unusual odor. In one situation, I noticed subtle changes in a wound compared to the previous day. I reported it promptly, and early intervention prevented the infection from progressing. Patient education is another key part of post-operative care. Before discharge, I explain how to care for the wound at home, what normal healing looks like, and which warning signs require medical attention. I also encourage and assist with early, safe mobilization to reduce the risk of complications such as blood clots and chest infections. For me, post-operative care means looking at the whole patient, not just the surgical site. It requires careful monitoring, infection prevention, pain control, patient education, and teamwork to ensure a safe and smooth recovery.
How do you ensure patient safety during a night shift when the ward is short-staffed?
Night shifts with low staffing can be demanding, but I focus on staying organized and proactive to maintain patient safety. At the beginning of the shift, I quickly assess all patients to identify who requires the most attention. Patients who are unstable, confused, at high risk of falls, or recently post-operative become my priority for closer monitoring. I perform an early safety round to ensure everyone is positioned safely, call bells are within reach, and any immediate needs are addressed. Clear communication with colleagues is essential. We divide responsibilities clearly and agree on how to support each other if an emergency arises. If support staff are available, I delegate appropriate tasks such as assisting with toileting or basic care, so I can focus on medication administration and clinical assessments. Time management is also very important. I combine tasks whenever possible. For example, when responding to a call bell, I take the opportunity to assess the patient's overall condition, check comfort, and address other needs at the same time. This reduces repeated trips and improves efficiency. I increase vigilance during night shifts by performing regular rounding and paying close attention to patients who appear restless or at risk of falling. If needed and feasible, I place high-risk patients closer to the nursing station for easier observation. By prioritizing effectively, communicating clearly, delegating appropriately, and using time wisely, I'm able to manage short-staffed night shifts while keeping patient safety at the center of my practice.
Describe a time you had to perform a rapid response or code blue.
I remember a code blue situation that truly tested my ability to stay calm and respond quickly. It was during a night shift while I was doing routine rounds. I noticed that a patient who had been stable earlier suddenly appeared pale and was not breathing. I immediately checked for responsiveness and a pulse. There was no pulse. Without hesitation, I activated the emergency response system and called for help. I began cardiopulmonary resuscitation immediately, starting high-quality chest compressions in the center of the chest, ensuring adequate depth and rate. Within moments, colleagues arrived with the emergency equipment. The defibrillator pads were attached, oxygen was provided, and the airway was managed. I continued compressions while the cardiac rhythm was assessed. When a shockable rhythm was identified, the team delivered defibrillation as per protocol. I resumed chest compressions immediately after the shock. We worked together efficiently, rotating compressors to prevent fatigue and ensuring continuous high-quality CPR. Medications were prepared and administered as directed. After several cycles, we reassessed and detected a pulse. The patient's color gradually improved, and spontaneous breathing began to return. Once stabilized, the patient was transferred for advanced care. This experience reinforced for me that in cardiac arrest situations, rapid recognition, immediate CPR, teamwork, and clear communication are critical. Staying calm and following established protocols can make the difference between life and death.
How do you prioritize care for three patients? One with low BP, one in shock, and one with a transfusion reaction.
In this situation, all three patients are unwell, but I must quickly decide who is at the greatest immediate risk of death. I use the ABC approach: airway, breathing, and circulation. My first priority would be the patient in shock. Shock can rapidly lead to organ failure if not treated immediately. I would assess airway patency, breathing effectiveness, and circulation right away. If the patient is unconscious or not breathing adequately, I would activate the emergency response system and begin basic life support as needed. At the same time, I would delegate clearly. I would instruct a colleague to immediately stop the blood transfusion for the patient suspected of having a transfusion reaction. Stopping the transfusion is the first and most critical step in managing that reaction, and it can be done quickly according to protocol. This delegation ensures that no time is wasted. Once the shock patient is stabilized or additional help arrives, I would reassess priorities. The patient with low blood pressure would be evaluated next. I would check for symptoms such as dizziness, confusion, or signs of poor perfusion. If appropriate, I would position the patient flat with legs elevated and prepare to administer fluids or medications as prescribed. Throughout the situation, I would continue reassessing all three patients. I would also ensure the emergency bell is activated early to bring additional staff support, as managing multiple critical patients requires teamwork. In emergencies like this, my focus is on identifying who is most unstable, acting immediately to preserve life, delegating clearly, and reassessing continuously. Patient safety and rapid prioritization guide every decision.
What do you check before administering a PRN medication?
Administering a PRN medication is never automatic. It requires proper assessment and clinical judgment to ensure it is appropriate and safe at that specific time. First, I review the prescription carefully. I confirm the medication name, the indication, the correct dose, the minimum time interval between doses, and the maximum amount allowed within 24 hours. I make sure the order is clear and valid. Second, I assess the patient directly. If the PRN is for pain, I ask the patient to rate their pain using a standard pain scale and describe the location, intensity, and type of pain. If it is for nausea, anxiety, or another symptom, I ask focused questions to understand severity and onset. I also observe nonverbal cues such as facial expression, posture, and overall comfort. Third, I check relevant vital signs when necessary. For medications that may affect blood pressure, heart rate, or respiratory rate, I ensure those parameters are within a safe range before administering the drug. If any readings are outside safe limits, I withhold the medication and consult the doctor. Fourth, I review the medication administration record to confirm when the last dose was given. I ensure the required time interval is passed and that the total daily dose will not be exceeded. After administering the medication, I document the reason for giving it, my assessment findings, and the time of administration. I also return to reassess the patient and evaluate the effectiveness of the medication. This full assessment, administration, reassessment cycle ensures that PRN medications are given safely, appropriately, and effectively.
How do you ensure effective handover during shift changes?
I believe a good handover is the bridge between shifts. It must be clear, complete, and well organized to protect patient safety. Poor communication during handover can easily lead to misinformation and errors, so I take it seriously. Before the handover begins, I prepare carefully. I review each patient's chart, update any new observations, and ensure documentation is current. I take a moment to think about the key points the next nurse needs to know. This helps me present information clearly and avoid forgetting important details. During handover, I use a structured communication method such as ISBAR, which stands for Identification, Situation, Background, Assessment, and Recommendation. I begin by clearly identifying the patient. Then I explain the current situation and any immediate concerns. I briefly outline the reason for admission and relevant background information. After that, I share my latest assessment findings, including vital signs, wound condition, ongoing treatments, and any changes during my shift. I finish by explaining what still needs to be done, such as pending tests, medications due, or reviews required. I also encourage the oncoming nurse to ask questions. Handover should be interactive. It is not just about giving information, but ensuring it is understood. When possible, I prefer bedside handover. This allows the incoming nurse to see the patient directly, check equipment, and confirm details in real time. It also helps the patient feel included in their care. After completing the handover, I ensure it is documented appropriately. A thorough and structured handover reduces the risk of errors and allows the next shift to begin with confidence and clarity.
How would you communicate a complex diagnosis to a patient with no medical background?
When I explain a complex diagnosis to a patient, I remember that they may be feeling frightened or overwhelmed. My goal is not to use complicated medical terms, but to help them clearly understand what is happening and what the next steps will be. I begin by choosing a quiet and private space so we can talk without interruptions. I sit at the same level as the patient to create a calm and respectful atmosphere. I start by asking what they already know about their condition. This helps me understand their level of knowledge and correct any misunderstandings. I use simple, everyday language and avoid medical jargon. Instead of technical terms, I use words that are easier to relate to. I often use practical examples or comparisons to explain how the body works. Simple analogies can make a difficult concept much clearer and less frightening. I speak slowly and pause regularly to check for understanding. I observe the patient's facial expressions and body language to see if they seem confused. I encourage questions and answer them patiently. If needed, I repeat the explanation in a different way. Sometimes I use simple drawings to help explain what is happening inside the body. At the end of the conversation, I ask the patient to explain in their own words what they have understood. This allows me to confirm that the message is clear. I also provide written information if available and reassure them that they can ask more questions at any time. Clear communication builds trust, reduces anxiety, and empowers patients to take part in their own care.
How do you handle criticism or feedback from your supervisor?
I welcome feedback from supervisors because I see it as an opportunity to improve, not as criticism. Nursing is a profession where small details matter, so constructive feedback helps me grow and provide better care. Earlier in my career, I sometimes felt uncomfortable when mistakes were pointed out. Over time, I learned that feedback is meant to strengthen practice, not weaken confidence. I remember a situation where a supervisor spoke to me after a shift and explained that although my documentation was generally accurate, some of my discharge notes were missing important details. She explained how incomplete information could affect continuity of care. At first, I felt slightly defensive, but I chose to listen carefully. I thanked her for pointing it out and asked for clarification on what needed improvement. She reviewed examples with me and explained what information should always be included. I took notes and made a simple personal checklist to ensure I would not miss those points again. Within a short time, my documentation improved noticeably. That experience changed how I view feedback. Instead of feeling criticized, I now see feedback as guidance that helps me become more competent and professional. Today, I actively seek feedback from supervisors and senior colleagues. I believe that being open to improvement shows commitment to patient safety and professional growth.
How do you care for a patient whose cultural beliefs differ from your own?
I believe respectful care means recognizing and honoring a patient's cultural beliefs, even when they are different from my own. Every patient brings their own values, traditions, and expectations into the healthcare setting, and it is my responsibility to provide care that respects those differences. In my experience, the first step is to listen without judgment. I once cared for a patient who was concerned about taking medication during a religious fasting period. Instead of dismissing the concern, I acknowledged how important the practice was to them. I reassured the patient that we would try to find a safe solution together. I discussed the situation with a doctor, and the medication schedule was adjusted so it did not conflict with a patient's beliefs. The patient felt respected, and treatment continued safely. In another situation, a patient's family wished to remain at the bedside longer than usual due to cultural expectations around family support. Rather than refusing immediately, I discussed it with the senior nurse. We found a balanced solution that maintained ward safety while allowing family presence in a structured way. This made the patient feel supported and reduced anxiety. These experiences taught me that cultural sensitivity is about communication, flexibility, and teamwork. It does not mean compromising safety or professional standards. It means finding practical ways to respect beliefs while still delivering appropriate care. When patients feel that their culture and values are respected, trust develops more easily. That trust leads to better cooperation, reduced stress, and improved outcomes.
How do you maintain professional boundaries with long-term patients?
Maintaining professional boundaries with long-term patients requires a balance between compassion and professionalism. When patients stay for extended periods, it is natural to build rapport. However, I always remind myself that my role is to provide therapeutic care, not to become a friend or a family substitute. I focus conversations on the patient's needs, concerns, and recovery. While I remain warm and approachable, I avoid sharing personal information about my private life. Keeping the focus on the patient ensures that the relationship remains professional and centered on care. I'm also consistent with all patients. I treat everyone with equal respect and attention, without favoritism. This prevents misunderstandings and maintains fairness within the ward. Physical boundaries are equally important. I use touch appropriately for clinical care or reassurance, always respecting personal space, privacy, and dignity. I remain mindful of cultural and individual preferences. When it comes to gifts, I follow hospital policy strictly. If a patient offers a small token of appreciation that is permitted, I handle it professionally and make it clear that my care is not influenced by gifts. If a gift is too personal or valuable, I politely decline and explain the guidelines. If I ever sense that boundaries may be becoming unclear, I seek advice from a senior colleague. In one situation, I cared for a patient who became emotionally attached during a long stay. I remained kind but professional and encouraged involvement with other staff and support systems. Professional boundaries protect both the patient and the nurse. They ensure the relationship remains safe, respectful, and focused on therapeutic care.